It's time for another 3-question warm-up. Let's get going. Which medication overdose can be treated with ammonium chloride? So ammonium chloride, that's going to acidify the urine. It's going to trap weak bases. So this is for treating overdoses of drugs that are weak bases. Things like amphetamines are examples. Next, what are the target cells of LH, luteinizing hormone? Well, LH is going to stimulate theca cells in females, but then it's also going to target the Leydig cells in males. Next question, what ovarian tumor matches each of the following statements? So first we have estrogen secreting precocious puberty. Think of a granulosa theca cell tumor. Next, produces AFP or alpha fetoprotein. Think of a yolk sac tumor, also referred to as an endodermal sinus tumor. Next, we have Samoma bodies. Think of a serous cyst adenocarcinoma. And then we have a testosterone secreting, also leading to virilization. Think of a Sertoli-Leydig cell tumor. All right, that's it for the warm-up. Let's get to that lecture now.
Hello again, and welcome to our Step 1 video on Streptococcus. In our last video, we looked at the gram-positive algorithm and then talked about Staphylococcus in some detail. In this lecture, we're going to cover Streptococcus. First, I want to go over the algorithm again, concentrating on the Streptococcus information. So, first, what's the focus of this algorithm? Remember, this is covering gram-positive organisms. That is, the bacteria that stain bluish-purple on gram stain. Now, let's specifically look at the gram-positive cocci. Do you remember how we differentiate the staph from the strep? Remember that we look for catalase. Staph is catalase positive and strep is catalase negative. Then what do we do to differentiate the various types of streptococci? Remember that this is when we look at the blood agar plates to see how the streptococci are interacting with those blood cells. There's alpha, beta, and gamma hemolysis. Alpha hemolysis is partial hemolysis that results in a green ring around the bacterial colonies. Streptococcus pneumoniae and Viridans streptococcus both exhibit alpha hemolysis. Now, beta hemolysis is complete hemolysis, and it's seen as a clear zone around the colony. Group A strep, also known as strep pyogenes, demonstrates beta hemolysis. This can be confusing. Don't think that the A in Group A strep indicates alpha hemolysis. It does not. Group A strep exhibits beta hemolysis. Group B strep, or strep agalactiae, also exhibits beta hemolysis. Finally, there's gamma hemolysis, where there's no evidence of hemolysis. Enterococcus usually exhibits gamma hemolysis, as does Streptococcus bovis. Okay, let's talk about one of the Streptococcus species that you definitely need to know about, and that's Streptococcus pneumoniae. You will also hear this referred to as strep pneumo or as pneumococcus. Strep pneumo appears as gram-positive diplococci. If you see that description, gram-positive diplococci in sputum, blood cultures, or CSF, you need to think about strep pneumo. In adults, strep pneumo is the most common cause of community-acquired pneumonia and bacterial meningitis, and it's one of the most common causes of otitis media and sinusitis. When describing pneumococcal pneumonia on a test, they will talk about a sudden onset of chills, lobar consolidation, and rust-colored sputum. Another thing I want you to remember is that splenectomy patients can have fulminant septicemia with strep pneumo. Remember talking about how encapsulated organisms are troublesome for asplenic patients? Well, strep pneumo definitely has a capsule. Do you remember the other important encapsulated organisms we talked about? You need to remember strep pneumo, Haemophilus influenzae, and Neisseria meningitidis. The great news about strep pneumo is that there are vaccines available for children and for adults. There are currently 2 available vaccines recommended in the United States: the pneumococcal conjugate vaccine, PCV13, and the pneumococcal polysaccharide vaccine, PPSV23. The PCV13 is the one typically given to all infants. Current recommendations say that adults who meet criteria for vaccination should get both the PCV13 and the PPSV23 vaccines spread out over time. There are a lot of indications for giving the pneumococcal vaccines to adults, and I'm going to quickly mention a few of them here. Anyone over 65. Or that should be 65 and over. Anyone 2 to 64 who has chronic illness like heart disease, lung disease, sickle cell disease, diabetes, or cirrhosis. Anyone who has disease that lowers the immune system, something like leukemia, lymphoma, kidney failure, HIV, or asplenia. Anyone who takes medicines that reduce immune response, like steroids, chemotherapy, or radiation therapy. And anyone who smokes or has asthma. As you can see, a huge portion of the population actually qualifies for pneumococcal vaccines, so keep that in mind. As for virulence factors, I think the most important for you to remember is that capsule. Another strep pneumovirulence factor to remember is an IgA protease. IgA is the immunoglobulin that helps protect mucosal surfaces from bacterial infection. Well, an IgA protease can cleave IgA, which would help create a survival advantage for bacteria colonizing on a mucosal surface. All right, now we're going to keep talking about alpha hemolytic strep, but move from strep pneumo to viridans strep. Remember that alpha hemolysis leaves that greenish ring around the colony on the blood agar. So viridans strep and strep pneumo will both exhibit alpha hemolysis. Now, I don't want you to get confused. Strep pneumo is the name of a single species, but viridans streptococci are a mixture of streptococcal species that usually exhibit alpha hemolysis. They're often classified into a number of different groups. I'm going to mention 5 groups of viridans streptococci so that you will at least have heard of these groups, but I don't think that you need to memorize them right now. There's a strep mutans group, strep salivarius group, strep aeruginosus group, strep mitis group, and strep sanguinis group. Sometimes the strep bovis group is included among the viridans streptococci, but we're going to talk about these streptococci separately. Viridans streptococci are considered normal flora, meaning they normally grow on mucosal surfaces of the oropharynx and the GI tract. And they typically cause few problems when they stay on the mucosal surface. When they inhabit dental plaque on the surface of a tooth, especially Streptococcus mutans, they can destroy the surface of the tooth, resulting in dental caries. When they get into the bloodstream, especially Streptococcus sanguinis, they can cause subacute infective endocarditis. So viridans strep are abundant in the oral cavity, usually causing no particular problem at all, but threatening to cause dental caries and to get into the bloodstream. And how do you think these bacteria would get from the oropharynx into the bloodstream? Well, one way is through just brushing your teeth, but another way is through dental procedures, and one that we hear more about. And not surprisingly, that's what kind of happens every day, occasionally ending in infective endocarditis. However, the point I want to emphasize is that this doesn't usually happen to people that have normal heart valves. The heart valves that become infected during an episode of bacteremia are those that have been previously damaged, especially ones that have had endocarditis before and prosthetic heart valves. Without some major pre-existing abnormality, that circulating viridans streptococcus species aren't usually going to be a problem. But when abnormalities are already present on or around the heart valve, we need to consider giving antibacterial prophylaxis just prior to dental procedures to prevent infective endocarditis. The favored antibiotic in this situation is a large dose of amoxicillin. Okay, now let's move on to a favorite topic for tests. Family members, neighbors, everyone wants to know about this. I'm talking about group A strep, also known as strep pyogenes. So group A strep is a pretty virulent organism. It can cause typical infections like strep throat, but it can also throw some curveballs at you like toxin-mediated illnesses and immunologic events. And so this is a good one to know well. Okay, let's look in the study guide. What human disease can be caused by strep pyogenes or group A strep? The first thing that comes to mind is probably one of the more common infections like acute pharyngitis, also known as strep throat. Group A strep can also cause cellulitis. Invasive infections include group A strep bacteremia and pneumonia. Now let's move on to immunologic illnesses associated with group A strep. This group includes acute post-streptococcal glomerulonephritis as well as rheumatic fever. Rheumatic fever is an uncommon complication of strep pharyngitis that probably results from molecular mimicry. That is, the immune system attacks host cells because the cell's antigens resemble that of the bacteria. Post-streptococcal glomerulonephritis occurs after either an episode of strep throat or a skin infection. It occurs when immune complexes are deposited in the glomerulus. No one knows why this happens in some people, but it likely results from streptococcal antigens being deposited in the glomeruli, which then induces an immune response there. The last category of diseases resulting from group A strep is the toxin-mediated diseases, and this includes streptococcal toxic shock syndrome, which relies on toxins that act as superantigens. This causes a rapid release of huge amounts of cytokines. Of course, there is some overlap in these categories. For instance, necrotizing fasciitis is an invasive infection where bacteria are spreading along fascial planes, but there's also a part that toxin production plays in causing that tissue necrosis. Now let's move on to some streptococcal skin infections. This is also in the study guide. What skin infections can be caused by both strep pyogenes and Staph aureus? Either of these bacteria can cause cellulitis, which is a deep skin infection. Here's an image of cellulitis of the leg. So you notice the redness and the edema. This is usually warm and very tender to the touch. This is super common. Anytime you are on call in internal medicine, you will be admitting somebody with cellulitis. Now, just to throw in a clinical pearl for cellulitis, when you have a patient admitted with cellulitis, one of the first things you want to do is take a pen and just mark a line around the red area. And that way you can pretty easily determine how quickly it's progressing or improving. Patients are often a little dubious of this technology that I'm talking about right here, but I'm telling you that this ballpoint pen is probably the best tool that we have for measuring improvement in cellulitis. And now moving on to impetigo. Impetigo is another that can easily be caused by strep or by staph species. Impetigo is a superficial skin infection that's characterized by redness and little vesicles or blisters. And these vesicles then rupture, leaking a yellowish fluid and causing honey-colored crusting of the lesions. It usually affects kids' faces, often around the nose, mouth, and cheeks. Let's finish our Group A strep discussion by talking about its immunological complications. You're going to see this information again in the course, but this is one of those topics that you may want to review a couple of times. Remember that in the immunological complications, tissue destruction is not due to the bacteria itself, but it's rather due to the body's immune response to the bacteria. So in rheumatic fever, you have Group A antibodies attacking the heart, probably because there are antigens in the heart tissue that resemble those of Group A strep. To diagnose rheumatic fever, we use the Jones criteria. First, you have to prove that there was a recent Group A strep infection, and then you need to observe typical manifestations of rheumatic fever in that patient. They need to have 2 major criteria or 1 major and 2 minor. The major criteria can actually spell out Jones, which is very helpful. The J is for joints, which describes a migratory polyarthritis. The O is supposed to be shaped kind of like a heart. It's a little bit of a stretch, but not too much. The heart represents pancarditis. Pancarditis means you can get endocarditis, myocarditis, and pericarditis. N is for nodules. These are subcutaneous nodules, sometimes referred to as Aschoff nodules. The E is for erythema marginatum. This rash will start small and then it spreads out into a large ring. The rash can appear and disappear over the span of a few hours. And the S is for synonym chorea, and this is sometimes called St. Vitus dance. It's characterized by uncoordinated movements of the face and the limbs. Now, for the minor criteria, these are kind of nonspecific and less important for test taking. They include arthralgia, fever, elevated ESR or CRP, and a prolonged PR interval on your EKG. Like I said, I think the major criteria are more important to know than the minor criteria, so I want you to pause the video and take this opportunity to write out the Jones major criteria. Remember that these are the ones that are supposed to spell out Jones. Good. Now let's move on to strep A galactiae, more commonly referred to as Group B strep. And sometimes you're going to hear it referred to as GBS. So GBS is the same as Group B strep and is the same as strep A galactiae. Remember that Group B strep is another beta hemolytic strep, like Group A strep. What does Group B strep cause? Well, it depends on who you are. It causes pneumonia, sepsis, and meningitis in babies, especially in those whose mothers were colonized with Group B strep in their genitourinary tract. In pregnant women, Group B strep can cause asymptomatic bacteriuria, urinary tract infection, postpartum endometritis, and bacteremia. In non-pregnant adults, we frequently see Group B strep in bacteremia and in skin and soft tissue infections. Let's look at that study guide again. Why is Group B strep so common in neonates? The reason why it's so common in neonates is because it's a normal vaginal flora in about 25% of women. These women are, for the most part, asymptomatic carriers. Group B strep rarely causes problems for them, but we know that infants born to women who are colonized with Group B strep are more likely to develop Group B strep infections than infants who are born to women who aren't colonized. The second part of this question asks what types of infections Group B strep usually causes in neonates. Well, it frequently causes meningitis, pneumonia, and sepsis, which are clearly very serious complications. So what do we do about this risk? The CDC recommends that obstetricians usually do a vaginal and rectal swab to detect Group B strep colonization at 35 to 37 weeks gestation. If the pregnant woman is colonized in the GI or GU tract, or if she had a positive urine culture for Group B strep during her pregnancy, then we give prophylactic penicillin during labor. The sole reason for doing this is to protect the infant from infection with Group B strep. And just as an FYI, there are 3 organisms that I want you to think of when you see a question about neonatal sepsis. And those are Group B strep, E. coli, and Listeria monocytogenes. We'll go over those again later in the course, but repetition is a good thing. All right, moving on to the next division in the gram-positive organism algorithm, Enterococci. Enterococci are gram-positive cocci that are catalase negative, and therefore they are listed with the streptococci. These usually exhibit gamma hemolysis, which is actually the same as saying no hemolysis. Just look at the name of the organism and it can tell you itself where it lives. Entero refers to the intestinal tract and cocci refers to its spherical shape. So when you hear the species names, it becomes even more clear. Enterococcus faecalis and Enterococcus faecium. So feces is included in both of these species names. Not an attractive name, not one that I would want, but very descriptive. You know exactly what you're dealing with by just hearing that name. Enterococci are usually normal gut flora. They're typically not very virulent, but they can definitely cause infection if they end up in a sterile place where they're not supposed to be. Enterococci are known to cause endocarditis and urinary tract infections, especially in the hospital setting. Enterococci, though not very virulent, are known for antibiotic resistance. So when they indeed end up causing a clinical infection, they can be very difficult to treat. If you hear the term VRE, it refers to vancomycin-resistant enterococcus, which can be a bear to deal with in hospital units with many chronically ill and immunocompromised patients. One other thing that I want to mention here is the confusion that can occur with Enterococcus and Enterobacter. Enterobacter is a gram-negative rod, and Enterococcus is a gram-positive coccus. Be sure not to confuse them. They're very different. All right, moving on to Streptococcus bovis. Strep bovis is another type of group D strep. So we had group A strep, there's group B strep, and there's this category called group D strep. Enterococcus used to be called group D strep, but now it's been reclassified. However, strep bovis continues to be referred to as group D strep. Strep bovis used to be considered one species, but it's now been divided into 4 species in the Streptococcus bovis group. These 4 species are Strep Galeoliticus, Strep lunatiensis, Strep infantarius, and Strep pasteurianus. I don't think that you need to remember these species, but you'll need to know the significance of Strep bovis as a group. Strep bovis is found in the gut. When it accesses the bloodstream, it can cause endocarditis. There's an association that you must remember regarding Strep bovis. When Strep bovis is found in the bloodstream or as a cause of endocarditis, the patient must be evaluated for colon cancer with colonoscopy. There's a lot of debate about what part the Strep bovis plays in the development of colon cancer, but regardless of its role in causation, there's an association between Strep bovis and colon cancer. In patients with Strep bovis endocarditis or bacteremia, about 15 to 30% of them will have colon cancer. So remember that association between Strep bovis bacteremia or endocarditis and colon cancer. Now it's time for your end of session quiz, so I want you to pause your video, go through those questions now, and then restart your video so we can go through them together. All right, let's go through these answers to the quiz, and this is a short one. First question, what organisms are most commonly implicated in subacute infective endocarditis? Viridans streptococci. These are probably the most common cause of subacute infective endocarditis. The other common causes include Enterococci, Streptococcus bovis, and coagulase negative staphylococcus like Staph epidermidis. The Haysick organisms, now these are not gram-positives, but you should know them as a possible cause of subacute infective endocarditis. Haysick stands for Haemophilus species, Aggregatibacter species, which was previously called Actinobacillus, Cardiobacterium hominis, Eikenella corrodens, and Kingella kingae. And the next one, what types of disease processes are caused by strep pyogenes or group A strep? Group A strep can cause disease by multiple different mechanisms. We talked about how group A strep can cause superficial or invasive infections such as pharyngitis, impetigo, cellulitis, and bloodstream infection. We also talked about toxin-mediated effects of group A strep infections like toxic shock syndrome. And finally, we mentioned the immune-mediated processes associated with group A strep infections like post-streptococcal glomerulonephritis and rheumatic fever. All right, that's the end of your end of session quiz and the end of your video on Streptococcus. I'll see you again next time.